you.
Now we'd like to welcome to the floor Dr. Sarah Baatout, head of the radiobiology unit at the Belgian Nuclear Research Center, as well as recipient of the 2020 title of Woman of the Year by the King and Queen of the Belgians, and recognized by Femme de Jourdois, excuse my pronunciation, as one of the 85 women that make Belgium move. And she will be speaking on the topic of personalized medicine for astronauts and radio protection in view of long duration deep space missions. Dr. Baatout, it's our pleasure to be hosting you today. The floor is yours.
Welcome.
Thank you very much. Thank you. It's really a pleasure to be here, and thank you very much for organizing this workshop. I'm really pleased for the presentation that has been given by the first speaker, Afshin. That was really impressive, and I would like to now focus more on personalized medicine in astronauts. So as we know, we have now about 60 years of expertise, of know-how on what is the behavior of the body of an astronaut during a space flight and a space mission, and going and starting from the first orbit at Yuri Gagarin in 1961, an orbit of 1 hour and 40, to now on the ISS, on the International Space Station, we have expertise and we know how the body behaves when these astronauts are staying for 10 days to 6 months to even more than 1 year sometimes. So we know that space flights have an important impact on the human body and that it has some consequences, but these consequences really very much vary between astronauts, and we are going to see that more into detail. And what we are preparing, and it's an international endeavor, is the future, the fact that we're still using a lot the ISS, the International Space Station, but we are moving towards using and going forward to developing a moon village, going towards missions to Mars. So we are going to longer mission with higher risk. As mentioned by the first speaker, so we are in this endeavor, the deep space getaway, going to the moon, going to Mars, and this deep space getaway is the first human spaceship to explore the solar system. This will be the most distant human space mission ever attempted, and it's also a testing ground for challenges of long duration human missions in deep space. And one of the main recognized showstoppers is ionizing radiation. There is an international panel dealing with all the risks, the possible risks, potential risks for human space exploration. And this is the Multilateral Human Research Panel for Exploration. And as you can see here on this slide, this panel evaluates and ranks the different risks and rates the different risks the astronauts are going to be facing. And as you can see in the last column, this is a column where you see more red, and the red comes from the fact that the consequences of this risk can be quite high, and we see that radiation, which is the last lane on this slide, represents a very high risk where it's absolutely needed to develop the necessary mitigation or countermeasures. So if we look at space radiation, as was already mentioned, we have three main characteristics and components of space radiation beyond low Earth orbit. First, we have the solar wind, which includes low energy electrons, protons, and alpha particles, which is a continuous flow, and which represents a low hazard. So it's not so much of a worry for us radiation biologists and radiation protectionists. But then we have the solar particle events, which are usually high energy protons. Usually it's an intermittent flux of these high energy protons, but it's very hazardous. So during that specific time of solar particle events, usually the astronauts are hiding and sheltering in very protected parts of the International Space Station. We'll see that in a few minutes. And then we have the galactic cosmic radiation, which are composed of mainly high energy protons, but also alpha particles, also heavy ions. And it's a continuous flux, hazardous, and for which we really need to develop further some countermeasures, some solutions. And we have also to take into account not only the first particles and the first flux of radiation, but also the secondary radiation. And these secondary radiation are due to the interactions of the primary radiation that I've just described with the nuclei that are present inside in the material of the spacecraft or inside the human body. So these secondary radiation can be even more detrimental to the human body than the first and the primary radiation. So it's also important to select carefully the material which is used for spaceflight, but also for a spacesuit, for example, to try to avoid at the maximum this secondary radiation production. Right now, the International Space Station is used, and is really important to understand and to develop mitigation ways and solutions in view of human space exploration to the moon and to Mars. So the ISS is really extremely crucial for all types of research, and we conduct a lot of research on the station. And right now we are conducting the immune follow-up of astronauts that have stayed at least 6 months to 1 year on the ISS, mainly Russian cosmonauts and European astronauts. We also have some detectors, some radiation detectors, because it's not that easy to characterize radiation in space, and we will see why in a few minutes. So we have detectors inside and outside the International Space Station. We also are very strongly involved in what we call in Europe the MELISA program, and the MELISA program is the life support, developing life support system, regenerative life support system in view of long-term missions. And we have sent 2 years ago the first bioreactor containing spirulina. So the level of radiation as we monitored on the ISS is roughly about 150 to 200 times the level of radiation on Earth. So the ISS is in orbit around the Earth 300 to 400 kilometers. So we are monitoring the radiation and characterizing the radiation through dosimetry purposes. And you see in orange in the picture some of the passive radiation monitors that we have on board of the ISS. And every 6 months we receive back these dosimeters, and we measure and characterize the doses, and we send some new dosimeters. We also have a mapping. We're also performing a mapping of the doses at different places. Here, as you can see in the Columbus module, where we can really measure, depending on the spacecraft material, on the code of the material, we can really measure the dose that penetrates inside the ISS and inside the Columbus module, and that can differ from place to place. We also measure the doses that are received by the astronauts. I was mentioning to you that depending if you have a solar flare, you need a specific sheltering, and you see 3 places inside the ISS, inside the International Space Station, that are particularly protected, and where the astronauts can reach and stay for the necessary time in order to be well protected. And one of the middle module that you see there is the water wall, because water contains, of course, a lot of hydrogen. It's hydrogen and oxygen, but a lot of hydrogen that is very useful to block and to stop most of the radiation. So it's a place where astronauts will go and reach and protect themselves. The lab sleep station is also a well-protected area using polyethylene. Polyethylene is a long molecule of carbon and hydrogen on each side of the carbon atom, and also hydrogen is very well known to protect well. So that's also a place which is a good shelter. An astronaut is exposed to many different types of stresses. And we can distinguish between the physical stresses, microgravity, weightlessness, radiation, I mentioned already, and then the microbes. We have inside the gut the microbiome of the astronauts, and it's about 500 grams to 1 kilo of microbes. And these 500 different types of strains, of microbial strains, have a different behavior potentially in space conditions. Some some will overgrow, will proliferate quite fast. Some others will inhibit their progression and their proliferation. So you have a dysfunctional, a dysbiosis, a change in the microbiome, which is very important to also quantify, characterize, and we are doing that also. We also have some psychological stresses that we have to take into account: isolation, confinement for a certain number of months, and also a very heavy workload that can induce also some different types of stress, and these sleep disturbances and circadian rhythm, which can be disturbed. And we can also, in a nutshell, as mentioned also by the first speaker, distinguish between the fact that you have space sickness, disorientation, a disturbed sense of equilibrium, also the movement, which is only recorded by the eyes, change of liquid distribution with a face thickening and thinner limbs. The kidney function is also increased, and calcium is also increased. Calcium certainly in the urine, that can induce a higher risk of developing kidney stones. Then the immune system can be disturbed, and we also have an increased microbial virulence that can take place, and loss of muscle mass and loss of bone mass. But this impact can vary between astronauts. And we also have, on top of this variability and variation between astronauts, we also have a difference between in the gender between female and male astronauts. And as we know, females have less hearing loss in space than their male equivalent. Females, also female astronauts, don't seem to have statistical increase of visual impairment, and they seem to have also a better immune response in comparison with male astronauts. But they seem to suffer more from orthostatic intolerance, and they also have more urinary tract infections. But again, between astronauts, you have also a large variability in muscle and bone loss, equal in females and in males. So a lot of variability. And when you look now to the variation in terms of cancer risks, it's also, as you can see, a wide variation. When you look at the risk of cancer on the ISS, as you can see, you have 0.1 to 1%. So it's quite already an important variation between astronauts. But when it goes to going to the moon or to Mars, this variation increases even more. As we can see, we have an exponential increase for lunar colonies, with a risk which can be even up to 10% higher than on Earth, and then on Mars mission, even a risk that can go up to 40% higher risk. Then if you look at radiation sensitivity, we are not all equal in front of radiation. Some people can be very radiation sensitive. We see that in patients, and some people can be very radiation resistant. So if you look at the range of radiation sensitivity, there again, we see that through our studies on astronauts, that some astronauts are very radiation sensitive, whilst others are less radiation sensitive. So it's also important to know that there is also a wide variation and a wide variability between astronauts. Then radiation sensitivity is also depending on the age, with at birth, and certainly at the embryonic stage, fetal stage, a much higher radiation sensitivity than later in age. And that can also be important to take into account when you look at the age sensitivity for longer missions to the moon and to Mars. And I would like to show you also the table that you see on the left-hand side, where basically the risk above 50 years old become much less. So that can also be an important factor to take into account for longer mission and higher risk remission and higher exposure to radiation. So the dose of radiation, as shown here, you can go from Earth, you have about 1 millisievert on Earth, 1 millisievert per year, and you increase of about 150 times on the International Space Station. To the moon, we can roughly count on 300 to 400 millisieverts. So it's 300 to 400 times more than on Earth. And then to go to Mars and back, we are facing radiation doses that in total are about 1,000 to 1,300 times more. And as I mentioned, every mission is specific. So the radiation doses is also mission specific, because the destination varies, the duration varies, the vehicle and the habitat design with the secondary radiation that can vary, and also the solar conditions. So let's speak a little bit about the moon and the International Moon Village, which is really an international endeavor in which humans and robots will work together on mining operations, astronomy, and or other projects. And the moon is very important as an archive of the Earth, her early history, but there is no magnetosphere, there is no general atmosphere, so there is no real protection from harmful space radiation. But it will be the moon experiments, and the moon station will be the springboard and testing ground for future exploration to Mars. We also have to, for the moon, we also have to design and rethink very deeply the spacesuit, because what we know from the Apollo program, there were less than 20 extravehicular activities during the entire Apollo program on the surface of the moon. But the future lunar programs are requiring a much higher level and doses and level of extravehicular activities for exploration on the surface of the moon. And we reckon of about 75 extravehicular activities per astronaut during their 6 months mission on the ground, on the moon ground. So this spacesuit will be the only protection during these exploration missions. That needs to be, this spacesuit needs to be resistant to abrasion, to reactive chemical dust, to UV temperature, oxygen, and weight. Needs to be suitable for walking, so it needs to be flexible, elastic. So it's very important also to develop the necessary know-how and expertise on the best spacesuit to protect, especially from radiation. And then on Mars, we are counting of about 1,000 times the dose in terms of the whole mission to go and back, being exposed to the deep space radiation and back. The Mars planet is the most similar planet to the Earth. It will allow us to understand whether life existed elsewhere in the universe beyond Earth. It has been once full of water and warmer, and it contains a little bit of atmosphere, 1% atmosphere. So it's potentially an habitable environment. What are the space radiation health risks? Well, first, we have a higher risk of developing cancer, radiation carcinogenesis, but also higher risk of developing acute and late central nervous system effects, like effects on the cognition, on the motor function, on the behavior, on the mood, and on the neurological disorders. Also higher risk of developing cardiovascular diseases, stroke, but also cataract, and also diseases related to aging. And then higher risk of developing, due to solar particle events, of developing acute radiation syndrome, which is including symptoms like nausea, vomiting, anorexia, fatigue, skin reddening, depletion of the bone marrow and of the blood forming organs. So we are really moving also forward to personalized medicine. So from the current approach, astronaut approach, which is basic, same countermeasures for everyone, for all the astronauts, we are moving towards a personalized medicine approach for astronauts, which takes into account their sensitivity, that takes into account high level data at the level of phenomics, of genomics, transcriptomics, exposomics, and metabolomics, and proteomics, and as well as epigenomics and microbiomics. So all these data are very important to gather before astronauts are going to space, to know them, to know the basic values, and also to be able to follow that up and to use a countermeasure when needed during the mission. And what is for to develop this personalized medicine, you need also the proper biomarkers. And what is a biomarker? Biomarker is any measurement reflecting an interaction between a biological system and an environmental agent, like the space environment. And that can be chemical, physical, or biological. There are different types of biomarkers, and especially for radiation, you have the biomarkers of exposure that can give you a direct idea of the level of exposure and the dose the astronauts have been exposed to. Biomarkers of susceptibility, these are genetic biomarkers that can give us an idea beforehand of which astronauts might be more sensitive to the space environment. Then you have biomarkers of late effects, so being able to predict in advance what type of reactions the astronauts might encounter. And then biomarkers of persistent effect that starts to develop from the moment of the exposure. And so if you look at these different categories, you can see that you have some cytogenetics biomarkers, mutations, transcriptional and translational changes, as well as DNA damage changes. So my institute, as the Belgian Nuclear Research Center, is working on different biomarkers. Here is a beautiful articles that have been published a few years ago with wonderful scientists, and most of them are here around the table and are presenting today. So, and this article is Vive la Radio-Résistance, which is especially devoted to what are the different ways that we can improve radiation resistance in astronauts. And that's going to be very useful and very important to tackle each of these ways, as you can see here, enhanced shielding, medical selection of radiation resistant individual, radioprotectors, gene therapy, biomarkers, hibernation, and biobanking, and regenerative medicine. So all these are very important issues that need to be tackled separately or together in order to make sure that we have safe trips to the moon and to Mars. And just a few slides about what we are currently doing at the Belgian Nuclear Research Center. We are working on different ground-based simulation platform, the random positioning machines, the bed rest studies, also different isolation platform in Antarctica. I was myself in Antarctica, and we're also flying different experiments that will show. So we are monitoring the individual radiation sensitivity of astronauts in space. We have spent 6 months to 1 year in space. We're also studying how the immune system and how isolation and confinement is changing metabolism and is changing basically how stress is changing health in different volunteers. And I was very happy myself to go to the Princess Elizabeth Station in Antarctica, but we are working mainly on the Concordia platform in Antarctica. We're also using a lot the bed rest study model from ESA, studying what is the impact of simulated microgravity on human health. And we're also irradiating a lot, so performing irradiation campaigns at GSI, but also in space, as you can see here, a skin experiment that flew in space a few years ago. We also had some cardiovascular experiment that flew to the ISS with the SpaceX program. And we also studied how the brain, how neurons are formed, and how the plasticity of the brain can be changed in space conditions. Important also to develop life on chip models for space in order to regenerate different types of tissues when needed, and to also keep a healthy gut microbiome. Very important to understand and characterize what are the most important bacteria that play a most important role that we need to keep and maintain in space conditions. And we flew also twice some rotifers in space. The second experiment came back 2 months ago, where we could really understand what are the molecular mechanisms that have been developed by these rotifers in order to endure and to be resistant towards radiation. So in conclusion, it's very important to develop this better personalized risk assessment for deep space exploration. We need more insights into the possible interaction effects of space flight stressors, if they are synergistic, if they are antagonistic or additive, and in order to reveal altered cellular functioning and as indication for potential countermeasure development. And let's not forget that all this space research is very useful on Earth in order to understand and to develop all different types of medical therapies, amongst others, better radiation therapy for cancer treatment. So I would like to thank you very much for your attention, and I'm open for any questions. Thank you.
Thank you very much, Sarah, for this excellent talk. Exciting stuff indeed.